All right, well, good afternoon and welcome. We are very excited to be here with you today for the webinar, Ask an Expert, Getting Healthcare in Maryland. My name is Jenny Garrison. I'm the Outreach Program Manager for Maryland Health Connection. And on today's call, we'll go through a few slides to give you an overview of Maryland Health Connection and some key tips to keep in mind as you're applying for healthcare through Maryland Health Connection. And then the majority of our time together will be spent with our expert, Ms. Wanda Oliver, and we will open for Q&A with the expert. And so we do ask you to please drop all of your questions in chat. Your audio and video has been disabled for this webinar. So as you have questions, please feel free to add them in chat. And once we get to the Q&A portion, then we'll start to answer all of your questions. Oops, let's go to the screen. So as I mentioned, I'm Jenny, I'm the Outreach Program Manager, and I'm joined by Ms. Wanda Oliver, the Deputy Director of Consumer Assistance Programs for the Maryland Health Benefit Exchange. So I'll take you through a brief overview of Maryland Health Connection. We are really excited because we are right now in open enrollment. It started on Saturday, November 1st, and it runs until January 15th. So for those of you who are looking to get healthcare through Maryland Health Connection, we wanted to create this space where you can get your questions answered and get yourself ready to apply for healthcare coverage. So we hope this is helpful for you. Let's see. So Maryland Health Connection is our state's official health insurance marketplace. You can see here our website. It's available in English and Spanish. And we also have a mobile app available for folks to enroll, which we recommend because it makes adding your documents into your account really easily because you can use your phone. And I also wanted to mention that our team is on the call. So a big shout out to Amy, who's going to be adding some essential links for you all in the chat. And our colleagues, Tim and Teresa, are here to help us as we navigate this webinar. So thanks to the team, and you'll see even more information come in through the chat for you. Let's see, as I mentioned, open enrollment is happening now, and you have until January 15th to take advantage of open enrollment. It is important to remember that you can enroll in Medicaid through Maryland Health Connection at any time of year. You don't have to wait for open enrollment to sign up for Medicaid. You can also take advantage of special enrollment periods. We know that life changes. Sometimes we lose jobs, we get married, maybe you're new to Maryland. There's special enrollment periods that open as your life changes, including also if you had COBRA and that coverage is ending, or maybe you don't need coverage now, but someone you know does in the future. There's easy enrollment programs where you can check the box on your state tax forms as well as unemployment forms to help you get contacted for coverage as well. Maryland Health Connection offers private health plans that are licensed and approved by the state, and we work with the major insurance companies in Maryland, including CareFirst, Kaiser, Permanente, United Healthcare, and WellPoint. We also offer dental and vision plans. And we also like to remind people that you cannot be denied health coverage anymore for having a pre-existing condition. And that does include mental and behavioral health conditions as well. And Maryland Health Connection is the only place where you can get financial assistance to lower the cost of your health plan. That comes in different types of financial assistance, including advanced premium tax credits and cost sharing reductions. When you apply, you would want to make sure that you indicate on the application that you are interested in seeing if you're eligible for financial assistance. Sometimes people believe that they're not eligible based on their income, but we recommend that you select that box to see if you can get financial help to lower the cost of your plan. All of our plans cover free preventive care. Preventive care are the visits that you would go to the doctor for before you're sick, such as your annual wellness checkups, different vaccines and screenings are covered for free, even if you haven't met your yearly deductible. And that's because research shows that regular visits help you to live a longer and healthier life. You can visit marylandhealthconnection.gov to get a full list of the preventive care and covered services that are available to you. All of the Maryland Health Connection plans also cover the same core benefits. And the core benefits are services that we know most people are going to need. So that includes doctor's visits, emergency visits, medications, preventive care, maternity and newborn care, and pediatric care. Also mental health care as well. And we always recommend, if you're looking for something specific, if you want to make sure your medication is covered by the plan you select, or you really want the details, look for something called the Plan Cost and Benefit Guide and Prescription Drug Search. And that way you can review what you would need for yourself, for your medical needs, as you're selecting your plan. Maryland Health Connection also has something unique called value plans. They are specifically designed to offer, they're specifically designed to offer lower deductibles and useful coverage for more healthcare services before your deductible is met. They're designed to lower your out-of-pocket costs for healthcare services that most people use frequently. All value plans must include doctor and specialist visits, generic drugs, urgent care, and more before you meet the deductible. And certain plans are also required to cover diabetes care management services and medications with zero cost sharing. So consider taking a look at value plans, and that information is available at marylandhealthconnection.gov. And I believe my colleague just added the link to that in the chat as well. As I mentioned, Maryland Health Connection offers standalone dental and vision plans. So maybe you have a health plan, but you just want dental care or vision care, you can purchase that separately. They do have a separate premium, which is going to be your monthly payment than your health insurance plan. And if you are enrolled in Medicaid, then you would get your dental coverage through Maryland Healthy Smiles Dental. And it is important to know that pediatric dental coverage is included in all private health plans offered on Maryland Health Connection. And you see here the four dental carriers that we work with, which is Dominion, National, Delta Dental, Delta Care, USA, Alpha Dental, and Care First Blue Cross Blue Shield. All right, and I also like to talk about dental health services. It does, facilitate quick conversations with your provider. Telehealth services are available through Maryland Health Connection plans, though they do vary by plan and company. Some telehealth services you could access include primary care, OBGYN, urgent care, behavioral health, including mental health care, as well as some medical specialists. All right, let's talk about some key things that we want you to keep in mind when you are applying for healthcare through Maryland Health Connection. Overall, in order to be eligible for a health insurance plan through Maryland Health Connection, you must live in Maryland. You must be a U.S. citizen or have a lawfully present immigration status, and you should not be incarcerated except if you are pending disposition. For the most part, an individual over the age of 19 must be lawfully present for 5 years before they're eligible for Medicaid, and that's commonly known as the 5-year bar. Or if an individual is offered insurance by an employer that is deemed affordable by the IRS, in that it does not exceed 9.9% of your household income, you may be eligible to receive financial assistance towards a plan on Maryland Health Connection. When you apply through Maryland Health Connection, you put in information about your household size and your household income. And household really refers to the people that are on your taxes, not necessarily who's living in your home. And when you apply and you put in your information, then your determination through Maryland Health Connection system would be that you're eligible for Medicaid or the Maryland Children's Health Program, which is known as MCHIP, or a private health plan with or without financial assistance. Here's the Medicaid income guidelines. So you can see here that there are different guidelines based on your household size, as well as if you're applying just for an adult or just for children, or if you're pregnant. So keep in mind there's different income levels based on household size and family composition that would determine your eligibility. And it is just another reminder that you don't have to enroll in Medicaid during open enrollment. It is open all year round. So when you get ready to enroll, we recommend that you gather all the documents that you're going to need for the application in advance. And so that helps you from having to step out of the application and then come back in later. And maybe you would have to start over or whatever it might be. It's much easier for you if you kind of gather all your documents first. And then when you sit down to enroll, you have everything ready for you. So what you need is your photo ID. So that would be for yourself and your household members, your immigration and citizenship information, as well as your employer and income information. And that could include pay stubs, a W-2, or tax statements, or tax forms. Additionally, if you have another type of health insurance, you would want to have the policy numbers ready to include that information as well. And similarly, if you have a health insurance plan through your job, you would want to have that information available as well. All right. And let's talk about the financial assistance that's available on the application. So as I mentioned, there is a section that says, do you want to know if you're eligible for financial help or Medicaid? Make sure that you check yes on that box on the application. There are different types of financial assistance available. The first is called Advanced Premium Tax Credits. These are refundable tax credits that help individuals and families afford healthcare. The amount of tax credits you receive depends on your household size and income. All, some, or none of the tax credits can be applied to your monthly premiums. And it is important to make sure that you keep your information up to date with Maryland Health Connection, including your income and household size, because any changes with that information would affect your tax credit. Okay, let's talk about calculating your income. We know that this can be a tricky part of the application. When you apply for healthcare through MarylandHealthConnection.gov, your income is used to determine if you are eligible for financial assistance. How it's calculated. The income information can be pulled from tax return information. And there's something called Modified Adjusted Gross Income, or MAGI. And MAGI is adding your adjusted gross income plus any Social Security plus any tax-exempt interest plus foreign income. And additional kinds of income that may not be accounted for on your tax return, they should be included on the application. And that is including earned and unearned income. Here's a few examples of earned income. That would be domestic and foreign wages and salaries, 1099 wages, and net self-employment tips. Some examples of unearned income include pensions and annuities, Social Security, unemployment, workers' comp, rental income, gambling, winnings. Unearned. So those would be your unearned incomes that you would include on the application. You may also need to include dependent income. A dependent income would be income from anyone else in your house aside from your spouse that is considered your dependent. If a dependent income falls under the IRS income reporting threshold, it may not be used to determine eligibility for insurance programs. However, you should still report this income on the application, and then the system really will determine if the income is used or not. Dependent tax filing status and residence also affect the determination for insurance affordability programs. This is a common question we receive. Social Security benefits, should they be reported? Yes, this income should be reported. Social Security retirement benefits should always be included in the application. Disability and retirement benefits should also be included on the application, even if the recipient is not applying for coverage with the rest of the household. SSI, Social Security income, should not be included on the application as part of household income. Anyone receiving SSI should already be enrolled in Medicaid. Okay. Calculating income, additional income. The application through MarylandHealthConnection.gov is able to collect two kinds of income, annual and monthly. Annual income is the projection of future earnings by the consumer, by you, and it should be collected from all household members. Your monthly income is used to determine Medicaid program eligibility. And lastly, fluctuating income, calculating your income when it changes throughout the year. For consumers, so if you have months where you don't earn income, this is something we mostly use or see with seasonal employees. The application has a section under variable monthly income to collect more information for households where income varies throughout the year. This is not something that should be used if you're an hourly employee. That would be recorded differently. However, accurate reporting is needed in both sections of the application, as the system uses each section differently in determining eligibility for insurance programs. Okay. All right. Plan costs and considerations. So just a few more minutes until we'll turn it over to Q&A. I see lots of questions coming in the chat, so that's very exciting for us. Keep your questions coming. Just a few more slides, we'll talk through what you should consider for your plan. And mostly this, when you look at metal levels, this is something that you'll see on the application when you're comparing your plans. And this, it doesn't mean, you know, the value of your plan if it's a good plan or a bad plan. A metal level refers to how much you pay and how much your insurance company pays. So with a bronze plan, you would have a lower monthly payment, but you would have higher out-of-pocket expenses. And so 60% of the insurance is going to be paid for by the company, and 40% is the consumer responsibility, is your responsibility. With the silver plan, you see the percentage change. And similarly with a gold and platinum plan, you see in platinum, the insurance company pays 90% of the coverage and you pay 10%. And you would have a much higher monthly premium, but throughout the year, you would see less out-of-pocket expenses. In other words, with a platinum plan, on average, you would pay 10% of the costs and your insurance pays the other 90%. With a gold plan, you pay 20%. Silver, you pay 30%, and a bronze plan, you pay 40%. There are catastrophic plans available through Maryland Health Connection for Marylanders who are under age 30. And these plans do not cover preventive care or core benefits, as we talked through earlier. They really only pay for major catastrophes, for major medical emergencies. It's just an option for you to protect yourself from kind of a worst case scenario. Everything that you would need for routine medical care, you would really be paying out of pocket for that. So while you would have a low monthly premium, you would have a very high deductible. And there are only two insurance companies that offer catastrophic plans through Maryland Health Connection, which is CareFirst and United Healthcare. And we'll go over these key terms here. You see them a lot as you go through the plan selection, and they're important for you to keep in mind as you're considering a plan in comparison to sort of your monthly budget. So your deductible is the amount that you owe for covered healthcare services before your insurance begins to pay. So let's say, for example, you pick a plan where you have a $1,000 deductible and it's February and you haven't gone to the doctor yet, but now you go to urgent care because you're sick and your urgent care visit is $300. You haven't met your deductible yet. So you have to pay for the $300 and that would count towards your deductible towards the $1,000. So you would pay out of pocket for the healthcare services that you need until you meet your deductible. And then your health insurance plan will start to pay for the coverage. Your premium is your monthly insurance payment. So every month you'll get a bill for insurance, and that is called your premium payment. So that's something that when you look at a monthly budget, you would want to factor in your monthly premium payment into your budget. So as you're looking at the plans, if you pick a plan with a high deductible, you will have a lower premium payment. So you'll have a lower monthly payment, but you'll have a higher amount to pay before your insurance starts to kick in. Similarly, if you have a low deductible, you would have a higher monthly payment. So you'll have less to pay out of pocket before your insurance begins to pay, but every month you would have a higher monthly payment towards your health insurance. All right, that was a lot of information, and we'll move into the Q&A in just a minute, but we do want to let you know that Maryland Health Connection has many ways that we offer help to you. And thanks, Amy, for dropping the link into chat for our Find Help page. We have our website where you can enroll, our mobile app where you can enroll, and we have something awesome called the Broker Connect form where you can put in your information to work with a licensed insurance agent, or we call them brokers, and they are authorized through Maryland Health Connection. A broker can't direct you to one insurance company or plan over another, but they'll help you through the application, and they'll help you as you're deciding what's the best plan for your health needs as well as for your budget. So if you filled out the Broker Connect form, a licensed insurance broker in Maryland would contact you in 30 minutes or less. We also work with a consumer assistance program, which is led by Wanda and her team, and they offer free in-person and virtual and phone enrollment assistance by trained consumer assistance workers throughout the state. So you could go and meet with a healthcare consumer assistance worker, and they would, similarly to a broker, help you with the application and help you understand the best plan for your needs and your budget. We also have a call center that you can contact, which offers their service in more than 200 languages, and they use the relay service for those of us who are deaf and hard of hearing. So I hope that as you're going through this process, you will reach out to someone through Maryland Health Connection. We are here to help you. Our service of help is free for you. And we are committed to helping all Marylanders get access to a health plan. We also have a couple more upcoming events. Throughout open enrollment, we'll be offering virtual enrollment events on Wednesdays, as well as our consumer assistance team is offering in-person enrollment events. So check out our Get Help page, and if you sort of scroll down, you can click on all the events that are coming up. And then in January and February, we work with the Maryland Insurance Administration to talk about how to use your coverage, where we dive into key healthcare terms and important things that you should keep in mind as you're looking to use your health plan. And you can always stay connected with us. I'm sure you've seen lots of healthcare information in the news. We are keeping you updated on our website. We have a What's New page where we're informing Marylanders about the changes and what they need to know for you. And you can also follow us on social media at Maryland Connect, and consider signing up for text alerts or email notifications to stay even more connected with us. All right. So at this point, I'm going to turn it over to, actually, I'm going to read questions that we've received in the chat, and we'll turn it over to Miss Wanda Oliver, our expert today, who will answer questions that have come. We're going to go in order that the questions were received, and hopefully that will, help everybody as you're navigating this process. So thank you so much for being here, Wanda. The first question today is, how about turning 26? Is that considered a qualifying life event?
Yes, actually, turning 26, because with the ACA regulations, once a once a dependent is turned 26, they can no longer be a part of their parents' insurance coverage. So, as they are considered aging out of their parents' plan, they would be able to have a life event to enroll in their own insurance plan. So yes, that would be considered a qualifying life event, and give them a special enrollment period to enroll.
Perfect. A follow-up to that question, would you recommend someone turning 26 that they enroll at the 60-day mark in advance?
Well, they have the 60-day window from the time in which the life event occurs. So with independents aging 26, they have until the end of the month in which they turn 26 before the coverage will end. For Maryland Health Connection plans, we allow 26-year-olds to stay on the plan till the end of the coverage year. So they don't necessarily have to remove themselves in the middle of the year. They can wait until December 31st and then enroll for the following year. So they don't have to do it in the middle of the year. But if they choose to, they have that option also that they can end the coverage in the middle of the year or at the time of their birth date at the end of that month, and then they have that 60-day special enrollment window to enroll.
Okay, thank you for that detail. The next question is from Diane. She says, my granddaughter is under my health insurance currently, but I will be retiring and on Medicare by the end of 2025 this year. Is that considered a qualifying life event for her to sign up?
Yes, because she will have a loss of coverage, so therefore she will have a special enrollment. If you choose to do it during the open enrollment period, she doesn't need a special enrollment to do that. If it's happening between November 1st and January 15th, she can just simply enroll in coverage for 2026 now during our open enrollment period. But if it were happening outside of the open enrollment, yes, she would have a special enrollment reason.
Okay, thank you very much.
You're welcome.
All right, the next question here is they say, hello, my mother is retired, a recent immigrant. She is not being claimed on our household returns. Is her retirement income the only income that would be considered when applying for a plan?
Yes, that would be the only income that's considered if she's not being claimed as a dependent on anyone else's taxes.
Okay, perfect. Thank you. Deborah says, deductibles, question mark. They are so high, I will never reach the amount unless you include my insurance premium. My premium alone this year was 10% of my income. I suppose that's more of a statement. That sounds like it is very high. Jennifer says, is financial aid available for dental plans?
No, we do not offer any financial assistance towards dental plans. Our dental plans tend to run very low, so they are very set at a very affordable price for the coverage that they are offering. So, no, there's no financial assistance towards dental plans.
Okay, thank you for clarifying. A question here, if we'll make this available. Yes, we are going to email the slides to you, to everyone who's registered for today's webinar. Sally says, when creating an account, does it matter who is primary? My spouse is primary for the IRS, but will be eligible for Medicare a few years before me.
So yes, whoever is the primary applicant on the account typically will have the the access to the account. Um, for spouses, we encourage you to list the spouse that is not listed as the primary applicant to include them as an authorized representative. That way, both of you have the ability to um, make changes or contact us for information regarding your account. However, whoever is the primary tax filer will be the primary subscriber for the insurance company. But as far as our application is concerned, who is ever listed first is considered the primary applicant and therefore the primary point of contact for that household.
Okay, very interesting. Thank you for clarifying that.
You're welcome.
Jennifer says, what if my income this year is lower than last year due to me not working anymore? What documents can I submit to demonstrate that?
So with loss of income, if you have some sort of separation notice from your employer, you can always submit that. If you've applied for unemployment benefits, you could submit that. We also have a no income affidavit form that you can complete and submit as proof that, or as verification that you no longer have income. It will ask certain questions as to when your job ended and when you received your last pay and things like that to kind of verify or document that you're not currently receiving any income.
Okay, thank you.
Mhm.
All right, the next question says, I will be Medicare eligible in November 2026. How will this affect my ACA plan for my wife and I? She will not be eligible for Medicare until 2028.
So for anyone who's Medicare eligible, you will be able to you would be able to your spouse would be able to maintain the current enrollment. You will no longer be eligible for any financial assistance yourself, but your spouse would be able to continue with financial assistance. Um, if you are the primary applicant, then we would need to make changes to allow your spouse to become the primary applicant on the application so that the insurance coverage would then be under them, and then we can always speak with the carrier if it's in the middle of the plan year to make certain that any deductibles that you've already met or anything like that is transferred over to that spouse. So those types of things can be done, but it's always important to be proactive since you know that you'll become Medicare eligible in November. I would suggest starting that process in October, so that you have everything straightened out before November comes. That way, the transition will be smooth, and the crossover will not hinder your access to your insurance benefits.
That's a really good suggestion. William says, I'm currently on Medicaid, but I'm turning 65 on November 27th of this year. Can I get any assistance regarding enrolling in a private health insurance program now that I'm no longer going to be eligible for Medicaid via Maryland Health Connection?
So, although you wouldn't be eligible for Medicaid via Maryland Health Connection, there are Medicaid programs that you may still be eligible for as a Medicare recipient, but you would need to apply for those through the Department of Human Resources. And I'm sorry, their name is the Department of Human Services now. Sorry, I'm aging myself. They actually have programs that can assist with helping to pay part or all of your Medicare premiums. It depends on your income, your household composition, or household size, things like that as well. But those programs do exist. As far as any private plans, you would have to go directly through the carrier. They also have supplemental plans specific to Medicare recipients that are much cheaper than the plans that we offer on the exchange. Some of them based they're based on people who are 65 and older, so they only cover limited services. There are some Medicare recipients who are under 65, and in those instances, you can choose to keep your plan on the exchange, but you would then have to pay the full premium if that's your situation, because we do run into individuals who are under 65 who require certain services that the Medicare plans don't cover. Like for women, most Medicare supplemental plans do not cover GYN visits and things of that nature because typically people 65 and older don't require that type of stuff any longer. But if you are under 65 and still need those types of services, then you would need to you have the option if you are already in a plan with us at the time your Medicare starts, you can remain on that plan, but you would then have to pay the full premium. There would be no financial assistance available to you through the exchange.
Okay, wow. Gotcha. Thank you for that, Wanda.
Mhm.
You really are
You're
the expert. Victoria says, what about hourly employees who receive tips? Does that fall under variable monthly income?
So with employees who receive tips, what we typically ask is that if you are a hourly employee, we understand that your income can change daily, but we would, if you are paid with a pay stub, we encourage you to take an average of your monthly income from, for one whole month and use that as your average income. Although it fluctuates, unless it's like drastically different, I don't encourage you using the fluctuating income because that tends to cause problems at the end of the year because that only looks at that year. So if you are Medicaid eligible, it's going to stop at whatever year, at whatever month you stop entering income. So if you only enter income from the time in which you first apply, which let's just say, for example, you enter income in June, and then you enter different income all the way up to December. At the time we do renewals, or at the time your renewal comes, the system's going to look at your income as zero because there was nothing there for January through June. So you're gonna, I would suggest using just the regular income for hourly employees, and then when you renew annually, if your income has changed, then go in and update that income. But I don't encourage you using the fluctuating income because it causes more problems than it helps.
That's really helpful. I know a lot of people work on tips, and I know that that could be a tricky spot in the application. So thank you
Yes.
for that. All right. Daniel says, I recall there was a plan where 60 or 90 days of certain medical expenses before the policy kicks in were covered, retroactive capture. Is that still available?
And that is for, I believe you're talking about for Medicaid. That's only a Medicaid thing where there's a retroactive um, coverage for unpaid medical expenses or medical bills. So these are bills that you've already been, billed for or issued for by a provider or hospital that are outstanding. And you receive them 3 months prior to the date you're applying for Medicaid. So if meet, you still would need to meet the Medicaid guidelines for your income for those 3 months prior. And it doesn't have to be for all 3 months. It can be any of the 3 months prior to your application date. So if, say, you're applying today, November 6th, then the look back or the 3 month period would be for October, September, and August. And any bills you've incurred at that time, you can apply to get those covered, but you still have to meet all of the Medicaid guidelines within those months of August, September, and October. So you need to have income within the income guidelines for those specific months. And we look at the income each month individually, not collectively. So you need to submit income verification for each individual month you're seeking the retro coverage in order to be eligible for that.
Okay, understood. Thank you.
You're welcome.
Jennifer says, does out of network 100% co-insurance mean I would have to pay 100%?
Yes. Anytime you are out of network and so that means the insurance company is not going to pay anything for your out of network visits or, in medical expense. So you would be responsible for 100% of that expense.
As a follow-up to that, if there's someone has a specialty need and there's only a provider in their area that offers that that's out of network, are there any exceptions for that?
They would have to speak directly with the carrier, their insurance carrier, and um, they often have a staff that will evaluate whether or not um, they can refer the consumer to a specialist that is out of network, but they would have to make that decision and determination before, and I would suggest they go to the carrier before they make any appointments or go to any appointments, because if they do it before it's approved by the insurance company, then you'll be fully responsible for the expense. So, but you can go to your insurance company and ask them, and if that provider is not a part of their network, but and they don't offer a provider that has that specialty, then a lot of times they will grant that referral. Kaiser Permanente does it all the time because they're such a small in-house network. So if they have someone has a special need that they cannot provide within their network, then they will authorize for consumers to go to another provider. But you have to do the request first.
Request the with your insurance company first.
Yes.
Okay. Thank you for that information.
Mhm.
Deborah says, how can I tell which plans are HMO versus PPO?
For our exchange plans, most of it is in the name. Most of them are in the names of our plans. So that's how we have made it easy for you to identify. Um, I don't think we have any plans that don't identify themselves as HMO or PPO. So
Okay,
that's the
that's helpful.
easiest answer for that one.
That's very helpful.
Mhm.
Um, what changes are likely after the shutdown ends? Will the APTC and premiums change?
Right now we have so right now the discussion that's with our Congress is not whether or not APTCs will continue. But APTCs will continue, but it's how they will be calculated and who will be eligible for them that's up for discussion. As of right now, Maryland is moving forward with things without the expanded APTC program. Previously, there was an expansion during the pandemic that allowed for people with incomes over 400% of the federal poverty level to receive tax credits. And it also allowed for um, lower, more tax credits and lower premiums for those who were under the 400%. With that cap coming back into play, um, anyone whose income exceeds 400% currently is not eligible for a tax credit as things stand right now. If Congress votes to put that back into place, then we will reevaluate everyone's eligibility and move forward. If they choose to make changes to who's eligible altogether for tax credits, we will then have to make those updates and changes as we are made aware. But as of right now, Maryland is working off of the 400% FPL cap for tax credits. If your income exceeds 400%, you will not be eligible for tax credits for 2026 as it stands right now. But in addition to that, we have also created a um, supplemental plan or subsidy plan that we are issuing to help offset the change that affects the consumers who are going to be getting less of a tax credit in 26. So there will be a state subsidy that's being applied to Marylanders who are under that 400% cap.
Gotta love living in Maryland. We have a very supportive system here.
We do.
Um,
We really do.
Thank you for that explanation. And I'll also add that at marylandhealthconnection.gov, we are keeping you updated on the changes. I believe it's / what's new. I also know that one of my colleagues has added that into chat as well. So keep checking marylandhealthconnection.gov to get your updates. All right. Thank you, Wanda. I think we have maybe 20 more questions and we have about 15 more minutes. So we're doing great. I'm fascinated with these questions. This is really awesome. Simone says copays go towards meeting the deductible, correct? So if I had high premium this year and didn't meet my deductible yet, would it make sense to just get a plan with a higher deductible and lower premium so I'm paying less monthly?
Yeah, no, copays unfortunately do not go towards your deductible. Um, Co-insurance can sometimes go towards your deductible, but those are two different things. But copays do not apply to your deductible. Things that apply to your deductible are payments for doctor visits, hospital stays, medical procedures, things like that can be applied to your deductible, but not your copays.
Okay. All right. Thank you for that.
You're welcome.
All right. On the next question, Sharon says the deductible applies to services that say co-insurance. If there is a fixed copay before deductible, you only pay your copay and the deductible pays for service rendered that are under co-insurance. Suppose that's more of a statement. Is that
Yeah,
correct?
that's basically a statement. Yes. Mhm.
Okay.
Mhm.
Jennifer says the website is showing tax credit for my premium given my income. Will that go away if the federal premium tax credits are not renewed? And I think you kind of just answered this. No, the tax credits are not going away. It's just the amount of tax credits that will be received.
Correct.
Melanie says, can I delete my app and start over? How do I do this?
Unfortunately, Melanie, no, you can't delete your app, but you can start a new application. And when you log into your account, just simply click change my information and it'll allow you to start a new application and you can, start from there. But no, you can't delete your application. Sorry.
Thanks, Wanda. Anna says, are asylum seekers able to enroll?
Yes, right now, as of right now, anyone who is classified as an asylee is still considered a lawfully present resident, so they can still apply for coverage. Yes.
Okay, thank you.
You know,
Melanie says, is the United Healthcare plan on the website considered a Maryland community plan? My doctor tells me they only accept United Healthcare Maryland community plan.
so United Healthcare on Maryland Health Connection is acts as a private insurance plan, and they also are one of our MCO plans under Medicaid. So I believe what your doctor may be referring to is the MCO plan for Medicaid recipients. And there are some providers who only accept that plan. So if you're not a Medicaid recipient and you're not receiving or you're not getting United Healthcare as an MCO, then they may not accept the private United Health plan. It's also important to know that as of I can't remember the exact date. I want to say sometime in September, Johns Hopkins Hospital no longer accepts United Healthcare. So that may be what, if that's a provider at Johns Hopkins, that may be what they're referring to. They are still taking the MCO, but they are no longer taking the private insurance plan.
Okay, interesting. Thank you for that clarification.
You're welcome.
All right. Someone says, are net capital gains and losses considered income for the application?
So that's a tricky one. We run into that all the time. So it all depends on how you are filing your tax return. So if you are self-employed and you are listing your net capital gains on your tax return, um, if it's under your AGI, then it will be counted as a part of your adjusted gross income. So it depends. I know a lot of people do a lot of adjustments on their tax returns. So it would have to be something we'd have to look at specifically to be able to answer that. But in general, yes, that is part of your income. So yes, it would be looked at or reviewed as part of income.
And the second part of that question is, since this is an estimate, cannot predict, how does this get trued up at the year's end?
So that's why we ask that you try to look at previous year tax return
Mhm.
when completing, if you're self-employed, um, or not self-employed, but even if you just have investments and you want to include and have to include that as part of your income, we always encourage consumers to look at whatever their previous year tax return was and try to estimate. I know in the economy we're in right now, it's kind of hard to estimate what your income may be for 2026, but that's the unfortunately that's the best option you have is just trying to estimate it. We can't predict the future, so that's the only thing. You always have the option though, if things change, to go in and report changes to your income throughout the year. It's not a one and done thing. So if you estimate right now, and then by March you see things taking a different turn, you can always go in and update your income to make changes.
Okay. Okay. Thank you.
You're welcome.
All right. Janice is having difficulty copying and pasting the links for various webinars. Janice, I'm going to give you my email, and you can email me, and I'm happy to send you the links that you're looking for. My email is jenny.garrison@maryland.gov. I'll add it into the chat right now. Let me see here. Sorry that you're having trouble accessing the links. Okay, the next question is from Jennifer. She says, are annual vision exams with an ophthalmologist considered preventive care and a value plan? Are vision exams preventive care and a value plan?
It would depend on the plan. I can't tell you specifically if it's included. It should be in your summary of benefits. If you have, enrolled in the plan, you can always look on there. It'll give you details about whether vision is included and what part of the vision. I know with United Healthcare, most of their plans include vision. And I think Care First as well, but it's very, very limited what it includes. My suggestion would be to contact the insurance carrier directly and ask them for clarity on whether or not what's covered as far as that plan goes.
Okay, good point. Okay, next question. And we still have a bunch of questions. So, one, how do you feel about going over a few more minutes, see if we can get some more
I'm
answers?
good.
Okay.
Sure, not a problem.
Okay, well, thank you. We'll try to keep going here till we can get through some of these questions. I see a couple of repeat questions, so I'll skip those. Lorenda says, I noticed on the main website that it only shows Care First, Kaiser, United Healthcare, and WellPoint. Are these the top choices of health plans offered?
Those are our only carriers we're offering this year. Aetna is no longer a part of the marketplace. They've chosen to not offer any insurance plans on the marketplace. So those are the only carriers that we are offering as far as private insurance plans.
Okay, so those are the insurance companies available.
Mhm.
The recording will be emailed to everyone after this, as well as the slides. Allison says, how was the specific age of 26 deemed to be a qualifying life event? Oh, this is a silly question. um, it's okay. Would she says, is it because the powers that be assume that most people's prefrontal cortex is fully formed, thus making them an adult? Okay, thank you for that silly question. Lorandea says, how are MCO plans chosen for new enrollees? Does it go by zip code?
So with MCOs for Medicaid, if you enroll in Medicaid, if you are a new enrollee, you have a window of time to enroll in your MCO of choice. And it is based on where you live, what MCO choices are available to you. If you do not choose your own MCO, then you will be auto enrolled into one. And it is definitely based on where you live, which options you have to enroll in. So for certain areas, like Kaiser Permanente does not cover certain parts of Maryland
Mm,
as an MCO. So therefore, if you live in certain areas in Maryland, you cannot enroll in the Kaiser MCO. Same thing with JAI. JAI Medical is only offered in very specific areas in Maryland as an MCO. So those are some of the MCOs where you have to be living in a specific area in order to enroll in that MCO. But for the most part, most of our MCOs are statewide, and you can enroll in whichever one you prefer. With MCO selection, I always suggest, if you already have certain providers that you want to stay with, make certain that they accept those MCOs before you pick, because once you pick, you're locked in for 12 months. You do not have the ability to change that plan for 12 months. So make certain that that's the MCO you want to work with, and that your providers accept that coverage.
okay, thank you.
Mhm.
And I will let everyone know it is almost 1 o'clock. We do have, I think, about 10 more questions. So we'll run over a little bit today, but just, alerting everyone of the time out of respect. The next question is from Francisca. She says, hi, my mom's permanent resident of Maryland, but does not have a job yet. What income will I include in her application?
So as so if she's just a resident of Maryland, if she has no income, then you don't have to include any income. Or if you're saying she's a lawful permanent resident that's in her immigration status, then she can also apply for coverage. However, she would not, unless she's met the 5-year bar. If she's met the 5-year bar, then she may be eligible for Medicaid. If she has not yet met the 5-year bar and she's just lawfully present in Maryland and a Maryland resident, then she would only be eligible to enroll in a private insurance plan, and she would be responsible for paying the full premium of that plan. She would not be eligible for any financial assistance for 2026.
Okay, thank you for that.
Mhm.
John says for 2026 plans, how do I apply with my for 2026 plans, do I apply with my 2025 income or do I estimate my 2026 income?
So yes, if you're self-employed and you don't know what your income will be for 2026, like I stated before, the best option is to look at whatever your income has been for 2025 and make an estimate. And if once 2026 starts, you see that your income is going to be a lot less or a lot more than you anticipated, I encourage you, you can always report changes throughout the year. It's not, just do your application during open enrollment and don't come back again. You can always make changes to your income or any other demographic information you have throughout the year. We encourage that you keep track of changes throughout the year. Don't wait until the end of the year to come back during open enrollment and make those changes. You should make them when you are aware of them.
And you can correct me if I'm wrong, but when you go into the application, there's a place where it would say make an update or make a change, and that's where you
Yes,
go in.
when you're in your consumer portal, in your portal, when you log in, there's an option to say change my information. And you can change, and that leads you to change anything on your application. You can change your address if you want to change your email address, your phone number, or if you want to go in and change your income, or even if someone in your household's moved, or you get married, someone you have a new child you want to add. So any of those changes can be done at any time on your application. You do not have to wait until the open enrollment period to make those changes and updates.
Thank you, Wanda.
You're welcome.
Adelina says, how much is the annual income limit for a household of a mother and minor child to qualify for Medicaid?
I believe you had that on a slide, didn't you, Jenny?
I think
I
you're
don't know it
right.
off the top of my head.
Adelina, we'll add in the link for the Getting Medicaid into the chat so you can take a look at those guidelines. The next question is,
Is she free?
Yeah, I think Jenny just froze.
Okay.
No problem. I'll keep reading the questions. Okay, I think the last one was Adelina's question. So, Rebecca asked, what is the difference between getting help from a broker versus the consumer assistance option?
So there's really not a whole lot difference. Only thing, brokers aren't well versed in Medicaid. So if you think you may be eligible for Medicaid, or if you have a mixed household where we have sometimes have children who may be eligible for MSHIP and parents eligible for private plans, then my suggestion would be to work with the consumer assistance worker because they can help you and give you more information on that. Whereas if you work with a broker, they would only be able to assist you with the private plan enrollment.
Thanks, Wanda. Daniel asked, can you clarify income verification process if you have transitioned from a W-2 work setting in 2025 to starting a new consulting business in 2026 where income is expected to be variable every month?
Sure. So if you are transitioning into a self-employment situation, there is a self-employment affidavit that you can use if your business is less than a year old and you don't have any tax returns or any records. You can use that to list what you expect your estimated income to be for the new year.
Okay. Melanie asked, question on the app regarding anyone enrolled in individual health coverage outside the marketplace who had an income change within the last 60 days and is newly eligible for tax credits. Do I answer yes if I took a severance package in January 2025 and have had no income for the past 60 days, or is that answer no?
So, Melanie, that question is typically for someone who's trying to get a special enrollment. So, if you're trying to enroll for current insurance for 2025, then yes, you would need to answer that question. But if you're only trying to enroll in coverage for 26, then you don't need to answer that question. That question is typically for anyone who's looking to get a special enrollment period for the 2025 enrollment year.
Gotcha. Okay, thank you.
Mhm.
I'm gonna skip over Linda's question because Sharon answered that and follow-up questions pretty comprehensively. So I'm gonna keep moving on. Robert asked, if I'm enrolled in an MHC plan in 2025, do I have to take action to remain enrolled in 2026?
No, if you choose to keep everything as it is, if there's nothing you want to change, then no, you don't have to take any action. You should have received a renewal notice. We sent out renewal notices in October. So if you don't want to make any changes and you want to keep everything as it is and you have your notice and everything looks good to you, then no, you don't have to change anything.
Okay. Kevin asked, how do I get information on my current ACA plan for the next year? My current Care First plan does not show up on the MHC website.
So if you're enrolled through the Maryland Health Connection currently and it's not showing, then I would suggest calling our call center and asking them to check your information for you to see if your enrollment is showing in our system. If there's nothing showing on your consumer portal, then there may be an issue because you should have received notification of your renewal for 2026. So, yeah, I would suggest calling into our call center and having one of the reps review or look up your information for you so they can check to see what your current enrollment is.
Jenny, would you mind putting the call center
She
number in
did.
chat? Okay.
She just
Just
did.
gotcha. Thank you. Okay, next question. Melanie says, I'm applying and showing as Medicaid eligible, but I attended the webinar last week that says I must be able to prove I am working 80 hours a month. I am no longer working as I retired early. How do I override the Medicaid option but still be considered for APTC credits?
So I'm not sure about the 80 hours a month. We haven't, that's a work requirement that won't start until next year. So that's not a requirement currently for Medicaid. So you can go ahead and enroll um in the Medicaid now. It's not going to require you, and the work requirement will have very specific options. It's not just work. You would be able to also do volunteer work, go to school, things like that, do trade studies. So it's not just working. But that ruling hasn't taken effect. That regulation is not in effect as of right now. And if you do choose to not accept the Medicaid, you would not be eligible for any tax credits. So you get one or the other as far as financial assistance goes. So Medicaid is considered a financial assistance program. So if you choose to not accept Medicaid, then you would not be eligible for tax credits.
Gotcha. Thanks, Wanda.
Mhm.
Okay, Lorenda has a question. Can you explain the importance of utilizing PCP and urgent care versus the emergency room for minor issues?
Well, no, I really can't. That I think that would be more of a clinical question. I can't explain the
I,
importance. I
as I'm seeing this, yeah, Sharon responded, and I'll just read this response. I think it was pretty good. Urgent
Mhm.
care is lower cost, usually walk-ins accepted and are available after hours. Your PCP usually, with your PCP, you usually pay your copay plus services rendered, but an advanced appointment is required. Going to the emergency room could cost you thousands more than going to urgent care for the same service.
Yeah, pretty much.
Okay, Deborah asked, what hours are brokers available? You mentioned they would call you within a half hour of submitting the request form. Jenny, is that I think we have the hours. I think we'll drop that in the chat. I think it's 8 to 4 most days.
Right, and
Um,
that's only on the broker. Well, we have two options right now. I think there's Broker Connect, and Broker Connect is available, I believe, from 8 to 4. But if you are connected with a broker directly, then that broker's hours may differ from when we would connect you to them. So they will reach out. They can reach out at any time once they get your information. Brokers work on their own time. They are private business owners. They just work through us to connect to consumers.
gotcha. All right. I think that is the end of the questions. Jenny, let me turn it back over to you to close us out.
Well, I appreciate all the questions, and Wanda, I appreciate you taking the time to answer everyone's questions, and hopefully it makes your enrollment experience a little bit easier. And I'll add my contact information in chat in case anyone has anything they want to follow up to me about. And And hopefully we'll see you soon. And if you have a great enrollment experience and you want to share your story, feel free to email me as well. We're always happy to hear consumer stories. And I thank you all very much for your time today.
Thank you.
Thanks again, Wanda. Thank you,
Thank
team.
you for having me.